Just now when I show you is from the company. It shows you very neat work. They normally do this sort of thing whenever they give you the disc for demonstration. It's neat and nice. But in real life, when you start opening up, this is what you're going to see. You're going to see bloody, you're going to see bone, you're going to see bone which is irregular. And this is exactly what you will see in Asian patients. And you've got to deal with your implant in that sort of situation. You raise a flap and you will have to deal with that. This is what the reality of things of being conventional implants. That's what you see. You put in your implants in, the steps have already been taught to you and talked about, and then you stitch it up. And obviously when you see this kind of gingiva, this sort of patient are either tobacco smokers, right? Or they chew tobacco, or they are big smokers themselves. And also, this very likely is a drinker, heavy drinker. So these are all indications that normally when you do these sort of cases, you have your doubts on the success rates. And you've got to be a little bit more careful. But these are the realities of things that you see. The one I show you from the company is a straightforward, neat case where they have taken the trouble to choose a perfectly good case, ideal case. You never see that sort of thing. Remember that Asian patients have got irregular morphology of bone. And you've got to deal with it as an irregular morphology, not a case of standard. You get a standard one, you open up, you see a beautiful thing, well and good. You got nothing to worry about. But in most cases, you do not see such a thing. And that's how you will do. And let's look at the last part of this presentation here. Now, after some while, the area heals up. It heals up pretty well, but you will never get a very uniform, straight gingival structure in Asian patients. You get bumps, you got valleys, you got mountains, hills and all that, except that. Alright? And that's how you have your denture placed in initially, and then you can see for yourself. The implants are already exposed there a little bit. And those are the 6 implants, 2, 4, 6, 8 implants that is placed in. Again, maxillary bone is very soft. They are not as good as mandibular bone. When you have so many negative factors, like the patient smoking, alcohol taking, thick gingiva, poor oral hygiene, the chances of failure is greater. Okay? Plus, when you have a low sinus case like this, the chances are that this implants here, the chances, I'm not too sure whether this was successful, but I can bet my money on this case that he would have, within a year, these 2 implants would have been missing from this patient. The chances are that because what have you have got a little bit of bone. This one especially. This one maybe you can succeed. These 2, I have my doubts whether you can really succeed on these cases. So therefore, when you choose your cases, especially when you want to start your cases, start with the lower, or you start on the upper, see that you have an adequate bone vertically. The depth is important as well as the width. Now this is a case done by a colleague. He's actually a professor of oral surgery. He's a professor of oral surgery, and that is that. That's how you place the implant. And I'm quite sure that you may not get full success because I've done this sort of work before. I've done this many years. I started conventional implant about 15 to 20 years ago. I gave it up. I used to send my cases after that to a colleague of mine to put an implant, and I did a superstructure. Therefore, my own cases which I've done, my by conventional implant are very